Hello, my name is Heather Hornibrook, and I am the administrator for the Adult System of Care with Kern Behavioral Health and Recovery Services. Welcome today. Today's presentation is part 2 of a series titled Family Orientation Town Hall, which is focused on providing information to family and loved ones of individuals who have been hospitalized in an inpatient facility here in Kern County. Part 1 focused on resources and treatment options that are available to your loved one while they are hospitalized with one of our local inpatient facilities providing this information. We also had our patient's right advocate share information on the rights of the patient while hospitalized, the LPS conservatorship process, informed consent, and how to navigate through the hospitalization process. Finally, our family advocate shared information on what her role entails, the rights of family members, and how she can support family and loved ones during the individual's hospitalization. Today, we're going to present on what happens to your loved one when it is time for them to be released from the inpatient facility. If they are not connected to one of our outpatient adult teams upon admission to the hospital, the individual will either be linked back to their last outpatient team if they'd had services within the last year, or they'll be linked to our crisis case management outreach team, which is also known as CCMO, if the individual agrees to services. They will then get linked to one of our outpatient teams. Some may already be receiving services from one of our outpatient teams and are already open. The first presenter, Griselle Monderi, is a supervisor of the adult wraparound team, and she will discuss the intensified treatment and services provided by her team to your loved ones as they discharge from the hospital. The second presenter, Ada Azevedo, is a supervisor of one of our adult outpatient teams, Northeast Rock. She will discuss how her team supports your loved one while in the hospital and as they discharge back into the community, sharing the types of treatment and services available by an outpatient team. Griselle, up to you.
Hello, everyone. My name is Griselle Monderi. Thank you all for joining us. I'm the supervisor for adult wraparound and crisis navigation, and I'll be talking to you a little bit about what my team does. Next slide, please. So adult wraparound is designed to be a short-term level 4 adjunct services. Adult wraparound is a resource designed to intensify services for clients that are open to outpatient services and utilizing crisis services instead of lower level care, such as a treatment team, coping skills, and family support. The goal is to reduce their symptomology or intensity of impairing symptoms through safety planning, interventions, increase services and linkage to treatment, and reroute the need for higher level care. Next slide, please. So who are we and how do we function? As a short-term level 4 intensified services, we really focus on making sure that your loved one is receiving the level of services they need, especially after a crisis or hospitalization. Recent discharge is very important for adult wraparound to wrap around the individual as soon as possible. We're an adjunct team, so and a way of intensifying services is working with the primary treatment team that is already working with your loved one to ensure that we are covering service gaps. If the individual needs services daily, we make sure that the individual is seen daily and receiving the treatment that's up to par depending on their acute of symptoms. We attend special individual daily treatment. These meetings take place at the hospital where all the treatment teams that are involved meet together and with the client and develop a plan for discharge, or what it's going to look like for the client once they discharge, what kind of services, resources do they need, even meeting some of their basic needs to ensure that the individual doesn't go back into crisis. So we coordinate with the treatment team and develop a plan. So who refers and how? Adult wraparound receives referrals from the hospitals. So they'll reach out and let us know when there's an individual at the hospital that may benefit from intensified services. We also receive referrals from treatment teams. So if your loved one is starting to show signs that they may go into crisis, their symptoms increase, they're more acute, the treatment team then sends a referral to adult wraparound so we can become involved prior to the client going into the hospital, possibly if we could do that. Next slide, please. So criteria for services for adult wraparound intensified services, again, we're short term. So we're looking at, is the individual using crisis services? Are they calling the hotline? Are they ending up at the psychiatric evaluation center? Are they at the hospital for mental health reasons? So we're really looking at either they're about to start going into crisis, we're starting to see the signs, or they went into crisis and we immediately get involved. And again, open to an outpatient team as we're adjunct. We work together and we coordinate services with their treatment team. If there's no treatment team, the client does get linked immediately to a treatment team, and adult wraparound still becomes involved at that time. The only clients that would not be for adult wraparound services or loved one that would not meet criteria would be if your loved one's already open to a full service partnership team. We have a couple of different specialty teams that are as intense as adult wraparound with different criteria. So that would be the only thing. And if we need to, we also work with them to make sure that you're linked and taking all the proper steps for that. Next slide, please. So my contact number is on there, and my office number. We're going to have an opportunity to answer questions towards the end of the meeting. I'm going to hand it over to Ada Acevedo. Thank you.
Thank you, Griselle. Good morning. Thank you for joining us. So today I'm going to have the opportunity to share with you what is it that we do as an outpatient team representing the adult system of care when your loved one is discharged from the hospital. First slide, please. So we like to think of the services we provide, next slide, please, as areas composed of case management, exploring all the different areas that we do from inpatient when your loved one is in the hospital to outpatient when they're coming out. And we like to also explore areas such as substances, because sometimes somebody may be in need of some substance use treatment. Next slide, please. So we also provide housing options, which is part of what sometimes when your loved one is inpatient, they may be lacking. So when we go and start assisting them while they are in an inpatient facility, we have to consider areas like home with family, if your loved one is, if you're waiting for them to come home, possibilities for a boarding care facility, possibilities for a room and board facility, or a sober living environment, which is when we provide more services for like substance use disorders, and also a transition housing like Friday Hope House, when the doctors indicate that they would like the client to be observed a little bit longer, so then we can have a facility with your loved one can spend a couple of more weeks to get observed. And the last but not least option would be the homeless shelter when there is no other options available due to timing or benefits or any of those components. Next slide, please. Some of the services that we also provide that are probably very important for us and for the family to be aware of are psychiatric services. Under our psychiatric services, we provide medication management. If the client is already with us, he is one of our clients under the system of care and they get out of the hospital, we make sure that they are seen by our doctors within 7 days of their exiting the discharge plan from the hospital. If we have a brand new client, then we go ahead and do something that is called psychiatric evaluation that takes a little bit longer time with the doctor, but it's still within that 7 days because we want to make sure that medication management is followed. We also provide our nursing staffing to answer any question that your loved one or yourselves may have regarding medications, side effects, anything that you may not be aware of. And also the pros and cons of, any education that you may need from like a new medication that you are not aware of, or something that you are concerned about. Maybe you feel like, oh, he wasn't sleeping before, now he's sleeping too much, or she's not sleeping enough. Whatever questions you may have, we provide that support as well. Next slide, please. How do we do this? Well, When your loved one is at the hospital, we are informed that somebody that we know is, or from our team, is in there and that they need our support. So we immediately begin by attending their it's called IDTs, the individual daily treatment planning that they do at the hospital. So we join it, and we join your loved one as well. We start making any collateral meetings with the family to find out what are some of the areas that we need to start covering. We try to provide psychoeducation to our clients about the symptoms that they are having, along with our doctors and our nurses. We start immediately trying to help with some coping skills and how to utilize them to kind of overcome whatever is going on while they're hospitalized, and also to assist them and strengthen their discharge post hospitalization. And we also do a lot of communication to reduce some of the distress that they are having about the whole process of being in the hospital. All of that, we also try to involve families as long as your loved one is able to give us that permission. We need their authorization to involve the family communication as well. Next slide, please. And with that, we will do it by obtaining what is called a release of information. A release of information is basically a document where your loved one is going to give us permission to speak to you, whether you are the main family member, an emergency contact, or someone, different. It may be a probation officer. It may be a doctor that they trust and they want us to share communication with them about what is going on, or one of the different housing groups that they have facilitated to us, like the board and care or the room and board. Or simply sometimes they want us to inform their payees, I'm not going to be able to come and pick up my monies this month because I'm in a different facility. So whatever that involves, as long as we have the confirmation that your loved one is giving us permission. We do assistance with monitoring a lot of their daily living when the clients are housed at different facilities. We go try to work collaboratively with all these room and boards and board and cares to make sure that the client continues with the progress that we want to see post-hospitalization. We try to make sure that at least we provide 2 intensive weeks after the hospitalization, daily, trying to contact your loved one daily so that we can see the progress that they are making. We are trying also to make sure that they are in that process of learning more what took place during the hospitalization and how they can verbalize and express their needs so that we can assist them with the next steps of getting better. Next slide, please. So the process is basically somewhat, it appears complicated, but it really is simple. We just make sure that we are able to discuss whatever the importance of the medication regime with the family. If your loved one has given us permission, then we go ahead, and if they give us permission, we meet with you and we are able to let you know what are some of the symptoms, some of the behaviors, and we invite you to come in and we encourage you to participate in the appointments with our doctors or our nurses or even the therapy sessions so that you are up to date with what is going on. We work collaboratively with any of the board and cares or the room and boards to make sure that the client is receiving appropriate treatment. A lot of families feel like I don't hear from them, I don't have any communication. So we also build that link, and we are able to sometimes meet the board and cares or room and boards with family members so they can see where their loved one is going to be residing. We tried as much as we can to be supportive of the housing programs and whatever is available to assist your loved ones out there. Next slide, please. So we have plenty of resources available in the system. We have NAMI for families of your loved ones, and basically you can meet or attend any of their meetings that they have, and you will hear some of the stories by other parents or other family members. And so you get an idea on how to contribute more with your loved ones and talk to them and have a better interaction with them. We encourage that your loved one attends therapy services. We have, through the adult system of care, undergone to what is called adult redesign. And the goal of the adult redesign is that we can provide as many services as possible with the ability to engage your loved one to get better. And therapy is part of that process. We want a balance. And when we talk about balance, one of the main things that we look for is medication treatment and therapy process, so that both of them can assist your loved one to get better at a sooner rate. We explore a lot of the self-care. We have, due to the pandemic, of course, COVID came and surprised us, but we have a center, the Family Learning Center, that usually provides classes where you can do a lot of activities and learn and have a lot of different skills that are new for you and that you can entertain yourself or your loved ones with. We do a lot of referrals. One of the things that we also work with is we are able to do a lot of referrals or assist your loved ones to attend their doctor's appointments and, make a doctor's appointments if they haven't done so, or a dental or any specialty that you have. Sometimes clients might need a neurologist. We do all of that and assist you in an effort to get your needs met to be able to get better sooner. We do referrals to, if you call us and say, my loved one is having a hard time, we do referrals to what we call the PEG, the crisis utilization area, or the psychiatric area, simply because we want them to be safe. Safety is one of the important components for us. So if it's after hours, if we cannot get to your loved ones, so we require that you are able to assist us by taking your loved one there, or by us contacting somebody who can take your loved one to those areas that for us are our crisis services that are there 24/7 assisting all of our clients. Next slide, please. And I think with that, I am concluding, and I'm going to hand it over to Heather Hornibrook. I just want to make sure to clarify also that the adult wraparound group, they are fantastic and they work collaboratively with us, and we tend to assist at the hospital time so that we can then provide extra support to the client, and so that you can see that our main goal is to make sure that they recuperate from the situation that they had when they went into inpatient, and get out to the outpatient with as minimum distress as possible. There you go, Heather. Thank you.
Thank you. Thank you both, Grisel and Ada, for your informative presentations. Now we would like to open this up for questions regarding our two presentations today. And I see that we have some in the chat box. First question, this will be for you, Grisel. Is there wraparound for kids?
That's a really good question. There is a youth wraparound team that works with minors. They work very similarly as the adult wraparound, but as we know, kids and adults have different needs, so they differ slightly with that component in mind. But there is youth wraparound. They do get involved post-crisis or while the client is in the hospital, and they do wrap around and intensify services along with the treatment team as well. Thank you.
Okay, another question. What if my loved one refuses services? That can be either one, but I'll start with Ada.
So when your loved one refuses services, we have to respect their position, but we do not go away. We stick around and we continue encouraging services, and we continue encouraging meetings with us, just like to see how they're doing, is it okay if we check in? And we also ask if we can speak to any family member. If they give us permission, then you will know that we will be probably, coming for a home visit, or making a phone call and requesting some assistance from you to be able to provide some services for your loved one. But we cannot at any point force treatment on anybody, because we are all, having that beautiful thing that is called rights, and we have to respect that from a lot of our clients. So Grisel, please share what are some of your thoughts on that?
So yes, very similar to what Ada stated, we understand that when your loved one's at the hospital or just had a crisis, they're pretty acute and usually their symptoms are pretty increased. So sometimes it can become overwhelming to accept services when there's a lot of resources being presented. We also don't just go away if the client says no. We understand that they may need some time. So we do come back and we explain our services. We offer the different options and resources that we have, and we try to work with them at their pace. And if allowed, we work with the family as well. So we do try to build rapport with the individual. Sometimes, really repairing any bad experience that they had, by really taking our time and being able to work with them. So we do try very hard to work with your loved one when they're not doing very well, and even when they say no, we continue to try. If it's a definite no, just like Ada stated, the client does have their rights. So once they're good, their symptoms are decreased and they're saying, no, I don't really feel like we need intensified services, then we go ahead and we accept the response. Thank you.
Thank you, both of you. The next question, I'm actually going to combine two questions because they're similar, and it'll be for Ada. And you touched upon this in your presentation, but maybe provide a little bit more. What is a release of information? And do I need a release of information to speak to family about client's treatment?
So a release of information is a document that protects our clients from having their privacy disclosed to anyone and everyone who may want to know what is going on. We have to follow certain guidelines, and according to HIPAA, that is one of those, that no matter what happens, we have to protect the privacy of the clients that receive services from us. So if your loved one decides, for whatever reason, maybe they engage into an argument with you and they happen to be upset today, and they come to one of our offices and say, no, I don't want to sign a release for them, I don't care. And then they go to the hospital, and they're at the hospital and they're still upset, and we ask them, can we please contact your family? Can we have a conversation? And they say no. We have to respect that, and we have to be able to do the best we can assisting our clients, and we will gather whatever information you as a loved one would provide to us, but we are not able to share any information that pertains to your loved one. This is something that it really is hard for us as a system, because we are unable to explain to you why are we silent or why are we not sharing with you the situation. But we have to respect that piece of privacy that our client is requesting. And so by that, we have to make sure that when the client is doing better, that we request again if we can share that information with you, the loved ones, so that you don't feel that we're not trying to work with you and your family. Thank you.
Okay, I have a few more questions here. This will be Ada as well. How can I get housing after a hospital discharge?
So what we do after you have been, we start the process during what is called the IDT, your daily treatment planning. And so if for some reason you do not have housing at that time, then we mobilize all the services that we can to find you placement. We call it placement. And so we have an internal procedure through our system where we can go ahead and find like a room and board or board and care for you to get placed post hospitalization. And also, if you are in need of substance use disorders, we find the facilities that can assist you with that process. And if you qualify for those, we make sure that we do all the arrangements, and at discharge time, we take you to one of those facilities. So it's a process that we initiate while you are in the hospital and through the IDTs that we call the daily treatment planning.
Thank you. Another question that actually has to do with housing too, a little bit different. Can I get housing if my loved one's problem involves substances?
I would jump on that. Grisel, I know that you guys have also a lot of resources, but I would say yes, because we are able to have different programs that if you as the person receiving services accept, we can have you attend and participate in. Each program has different requirements, so you know, they will let you know what is it that they need, and if you as the participant accept, then we can connect you and link you to those different programs. Even programs through, you know, the shelters, they also have established different programs that if you would like to participate, they would do it, and then you would be part of that, which involves substances and working on reducing your substances or stopping the substances that you have been brought in for. And Grisel, I don't know if you guys kind of do similar processes with some of the clients.
Yes, we do. Part of our intensification of services is visiting the client daily as needed. And that really provides the support. I know it's very difficult for individuals that suffer from substance use disorders or co-occurring disorders where they have substance use and then another mental health disorder that's really affecting them and triggering those acute symptoms. So coming in daily to make sure that your loved one is getting the support to stay on track with their programs, to reduce any opportunities for losing their placement or their housing due to either their acute symptoms or behaviors. Sometimes it could be triggering. So just having the intense support with the primary treatment team and adult wraparound and any party that's really involved with working with your loved ones, we really have a holistic approach in making sure that we're all working together and aware of what the plan is and what happens if there's an issue, what are we going to do? So we're working with the families and we work with the individuals. We're really thriving for that safety and the client success. Thank you.
Thank you. And this would go to Ada. Can family and loved ones be involved in the treatment while they're open to your team?
Absolutely. We totally encourage that. It's such a main difference when we see that the loved ones are here helping us encourage the person who needs services, because at any time we're humans, and sometimes as humans we forget, oh my gosh, I had a 1 o'clock pill and I forgot it. But if my loved one is around, they may be prompt to remind us, and that is a crucial piece of recovery. Also, families, helping families, you know, we want to see that participation. We want to see that your loved ones get better sooner because they have added support. Regardless, we have families who live out of town and they still call us and say, you know, I'm gonna stop by once a month. Can I get, you know, your support? Absolutely. Can we meet when you come? Do we go and meet with you at the boarding care facility so that you can see what your loved one is staying and what do they do for your loved one and how we connect in that picture. That is something that we encourage a lot. One of the main areas we encourage is when you have any questions or you are in doubt, if you think that your loved one is not progressing, to let us know, to share that information with us, and to attend some of the, you know, medication appointments or the therapy appointments so that you can see what is the progress and you can be involved in from beginning to like end of that continuous process. So yes, we encourage that a lot. Thank you.
All right, thank you. I have one more question, and this seems like a Grisel question. How long does the adult wraparound team work with our loved one?
That's a really good question. So we are short term. Our program is designed to be on average about 60 days with the idea that we come in kind of heavy, right? If we're covering any service gaps that may need in order to align with the acuteness of the client to ensure that our intensity is matching what the client's needs are. So if your loved one is benefiting from intensified services and we're seeing progress. Sometimes we keep the client open to our services a little bit longer. So we don't just close them at the 60 days. But it is important to note that if we're providing intensified services at an increased rate, we don't want to overwhelm your loved one either. We want them to continue to come to therapy and really take advantage of case management and resources that are available. So we really come in when we're looking at acuteness, any safety concerns, if there's any stable housing we can come in and support with, substance use, we can come in and support the substance use division's plan. So we work with your loved one as long as it takes. If your loved one ends up needing intensified acute services for much longer, there are other programs available for them. And at that time, we send those referrals. So your loved one won't be without intensified services if they continue to need it. They'll just be set up with a different program that will meet those needs. Thank you.
Well, I want to thank everyone for joining us today for our Family Orientation Town Hall, episode 2. I hope that you found this information really useful for yourselves, your other family members, and knowing what kind of treatment and resources are available for yourselves and for you to support your loved ones. Both of our episodes will be available on our Kern Behavioral Health public website. Thank you.